In this class we will discuss about bag technique. Okay. So this is a practical procedure to be asked in the practical exam of community health nursing, and sometime in theory as well a small question may appear. Okay. So what is bag technique? Anywhere when the word technique comes, it means it is a procedure where steps are to be told. Okay. So in bag technique we tell how we use the community bag. Okay. So community bag technique is a procedure using the skills and knowledge of preparing and using the equipments of community health bag for performing various interventions during home visiting. Okay. So it is a part of home visiting which we have already discussed. Okay. And it is always used in the community because in the centers or hospitals we have sufficient instruments in the almirahs and in the wards, but when we visit community we need some specific instruments which we have to carry during our home visit to the community so that we can use and provide nursing care. So first of all we should understand what is a community bag. So community bag or healthcare bag or a nurse bag, they have same meaning. Okay. So this community bag is a healthcare bag which contains all the essential or minimum instruments or tools to be utilized during the home care in the community. So simple definition, it is a bag which has many names: public health bag, community health bag, nurse bag, everything we can use. So which contains some pockets where we place instruments that we will use in the community. Okay. So simple definition, in your language you can write. The community bag is made of washable material, okay, that can be washed. Okay. And it has a wide strap to be hanged on the shoulder. Okay. So there is a wide strap we can hold on the shoulder and we can carry in the community easily. This community bag should contain two types of pockets. Okay, not two pockets, two types of pockets. Okay, so these are group of pockets. Okay, there are many pockets which are grouped under two headings: outer pockets and inner pockets. Okay, normally in outer pockets we keep the articles which are used before starting the procedure, and in inner pocket we use the articles for the procedure. Okay. So what we keep in outer pocket and what we keep in inner pocket we should know. Outer pocket of community bag contains newspaper, okay, old newspapers, and some extra paper for making paper bag. Okay, everywhere in nursing procedure we need some paper bag to throw the waste. Then a plastic linen, okay, or linen lining, the plastic spread we should keep so that we can place on the near the client or the where we are using where we are doing the procedure, so that the bed or any other article are not spoiled. Okay. So a plastic paper or plastic lining we should keep. Along with this, in outer pockets we can keep one apron. Okay, plastic apron to be worn for some procedures so that our clothing are not spoiled. Okay, so we can keep that one. Along with that, one hand towel, okay, for washing hands and wiping. Then one soap and soap dish we should keep in the outer pocket, and then pocket diary and pen to record the procedures. Okay, so these articles are kept in outer pockets. There are 2 or 3 outer pockets. Now what are kept in the inner pockets? Inner pockets contains all the essential, minimum essential articles which are to be used for the nursing procedure in the community at home level. This may contain some thermometers, oral or rectal in old times, and nowadays digital thermometer we keep. Then scissors, bandages for bandaging, forceps curved and straight, a box of slides, okay, for making the malaria slides, disposable syringes, sterile dressings, cotton balls, cord clamp in case of home delivery, micropore plaster, fetoscope, tape measure, one pair of gloves, then baby scale for weighing the baby, alcohol or spirit lamp, test tubes, test tube holder, kidney tray, bandages, and some solution like betadine, Benedict solution, spirit, ophthalmic ointment, weighing scale, BP instrument, stethoscope. They are kept in separate bag if there is no place. Otherwise, we can keep inside the bag. Okay. And any other article if it is as per objective of the visit. So these articles are kept in the pockets which are known as inner pockets. Okay. Have you seen this community bag anywhere during your service period? Yes or no? No. Okay. So we have samples here. So you can see tomorrow. You can ask staff. They can show you. Okay. After the class, I will also try if it is outside, then we can see. Right? So these articles are kept in the community bag. Now comes how we use it. Okay, what are the steps of using the community bag? So when we arrive at the client's home, normally the bag will be on our shoulders. Okay, bag will be here. We will go. We will ring the bell. Then we will try, first greeting will be there, we will tell our objective to the client, and then we ask him that where we should keep our bag. Okay, because bag should be kept on a dry surface and flat surface. Okay, so that the articles are not spoiled, they are placed on proper flat surface. So any place which is explained or told by the client or the owner of the home, we can place our bag. But keep in mind, we will not put our bag directly. Okay, what we will do? First of all, the bag is on our shoulders and we will open one outer pocket. And what we will do? We will take out the newspaper. Okay, old newspaper we will take out and spread on the surface told by the client. Okay, it may be a table, maybe a corner of the bed or anything. So we will spread the newspaper. Okay, and then we will place our community bag. Okay, so this is the first step of placing the bag. Now what we will do? We will place the bag on one side of the newspaper and keep the other side normal. Okay, we will place some articles there. What we will place? First of all, we can take out the hand washing articles. Okay, so one soap dish, one brush, nail brush will be there, and towel. We will take it out and place on the one corner of the newspaper. Okay, then we will ask the client that where normally you wash your hands. Okay, show me your hand washing area. Then they will tell, okay, this is our hand washing area. Then we will go with these articles, soap dish and brush, and we will wash the hands with all the proper steps of hand washing. And during this, we will explain the importance of hand washing to the client. Okay. Then what we will do? We will place the this soap and soap dish at that place and come back to our working area and wipe our hands with hand towel. Okay. So this is initial hand washing. Now we will start our procedure. Okay. So up to this level we have opened only outer pockets. Okay. Then we will also take out the diary and pen, we will place there, and then open inner pockets. Okay. Now, what we will use from inner pockets? First we will assess. Okay. What we will assess? That what procedure is to be done in the community. Okay. According to our home visit plan. We already made home visit plan. So what procedures are to be done? Accordingly, we will take out the articles. Not all articles are kept out. Only needed articles. For example, if we are using a thermometer for checking the fever, then we can take out the thermometer only. Then kidney tray and cotton balls, if we are using them for injection or dressings, seizures, plasters, we can take out and use. Okay. And after the procedure, we will place all the articles again in the inner pockets. Okay. Sometime, if the articles are soiled, we wash them then and there, and then after wiping, we will keep in the bag. Okay. But after reaching to the center, we will sterile them. Okay. But we should clean them at that place. Okay. Otherwise, our bag will be soiled. Then what we will do? We complete our task of providing nursing care, then clean and sanitize them, and will placed in the inner pocket. Now, again we will go to the hand washing area after doing our procedure, and again we will wash our hands. Okay. Then we will wipe our hands and take our soap and soap dish bag and place at one corner of the table till it dries. Okay. And till it dry, what we will do? Then we will provide health talk. Then we will provide health talk. Okay. Using our AV aids, we will explain, we will spread awareness, and it may take 10 to 15 minutes. By then our soap will dry and we will place in our outer pockets. Okay. So this is the simple technique of using the community bag. Okay. So normally these steps are asked in the examination. After doing this, we will place all the articles in outer pockets, and then we will write what we have done in the our using pen and diary, and then we will hold the bag on our shoulders, and then we place the newspaper. Again we will fold it and place in the outer pocket. So this is the whole process of bag tagging. Okay. Now, before leaving the place, we also make appointment for next visit, when we will come next. Maybe next month, maybe next day, as per the need of the community people or the person, we will make an appointment and then come to the back to the center or to the next home as per our need. So this is the bag tagging. Okay, simple. It is a practical procedure, and if possible I will show you this bag today itself.